Matters what your job is up here. Like, you end up loving your job because it's helping and feeding the community around you, and that's what we need up here. So it's very rewarding and very satisfying.
I love the diverse roles. Every day is an adventure. You never know what you're going to get. The people, the places you go. As a clinician, the conditions that you're working with as a generalist, you know, connecting with the tertiary hospitals down in Perth and giving people who live in the bush a really good opportunity to get services that otherwise they'd have to travel a really long way for.
Inside the hospital there is a whole heap of different skill set, and you can learn all those skill sets so that it'll give you good insight into health.
Kind of from day to day you might be working in all different areas. I just really think it's like honed my skills a lot and probably increased my confidence in myself as a midwife.
The experience here would not rival anything I could get in Perth, especially at my age. I think it's really kick-started my career.
It's opened up a lot of opportunities that I feel like I wouldn't be getting in a lot of other spaces and a lot of other areas.
1 minute you'll be looking at an ECG machine, and the next minute you'll be pulling down a fence, and then you'll be up fixing air conditioning units. Keeps you very active. If you're up to the challenge, it's a good lifestyle.
Here, you're the pathologist. Here, you're the X-ray tech. Or here, you're the plaster person. You gain skills by being exposed and being supported.
I think with like so many opportunities within WACS, whether it's, you know, within that clinical space or moving into a project, it is a organisation I can see progression in.
I've grown so much as a person, and I feel like I approach things so differently now. I have a greater perspective. When I do work with really vulnerable people and really vulnerable communities.
Health is the hub, I feel, of the community. It's a place where my whole family and community access, and I'd rather be on the inside making it better than on the outside.
If you do a good job, you know, you've helped save someone's life, or you know, you've helped someone when they've been down, or you've been able to help staff out, and that's what the job's about, is helping people out, and that's why I enjoy it so much.
My clients are I love them. They're just open, honest. I don't know what it is. It's just a nice job.
Being part of the hospital and the community here, just helping out where I can, I think it's really rewarding.
No day's the same, every day's different people all the time. It's not a boring job, you don't know what's going to happen.
You've got all these options. You can move within different regions, and that's the refreshing thing about this job, working with WACS.
So this year we've had our first school-based traineeships on site through a local training company. It's been really successful. This forms part of our commitment to Indigenous workforce, and also our commitment to keep young people in the town and ensure that people with families know that there is progression for their children to actually learn and be an effective member of the community and the healthcare community in WA. We are providing the opportunity for young people to progress into a health career effectively.
The bonuses of working in the Kimberley compared to working in Metro, there's a district allowance subsidy on top of your normal pay. You get an extra week of leave, Northwest leave. After 12 months of service, you're also eligible for the annual leave travel concession, which is a flight for you and your dependents, so your family, to the nearest major capital city or the equivalent.
It's been, I think, personally for me, one of the best moves for my career. I've got to experience so many different clients, fields of work, got to experience some amazing locations in Australia, flown out to remote locations that I probably never would have had the chance to visit if it wasn't for my work.
There's something in it for everyone, basically. Give it a go because you might find something that really fits you and what you actually want to do for the rest of your life.
If you're really serious about getting a job, the hospital system would be good to get into. They look after you.
Not only has WACS given me an opportunity for employment and training to develop myself, but also given me a steady career where now I have bought myself a house. So, single mum, very proud of myself, and also my work colleagues are proud of me. So, I wouldn't at all change working for WACS or working within the Kimberley region for anything.